Hello, good evening, and this official disclaimer, right? That all the images displayed during this medical session, they are for educational purpose and they are for mature audience. All right, welcome to session 24, and this is Perineum part 2. Now, as we discussed yesterday, we talked about the concepts of perineum, right? So today there'll be some revision, and on top of it, we'll be adding something extra, right? Okay, the most important part, I got few emails, and that is about that there was some confusion between the pelvic diaphragm. I'm good. There was some confusion about pelvic diaphragm. There was some confusion about some fascia, right? So don't worry. We'll be repeating it. Not only that, but see, there'll be few structures. Say, for example, uterus. So uterus in itself is a topic, right? So when it will come, you'll be very clear about some utrovesical pouch or say some other fascias. Right now, deliberately, we are not touching some of the ligaments or some of the other structures, right? To keep the things absolutely focused. Okay, so let's start with the peritoneum part 2. Now, today the focus would be on female peritoneum, right? Because we talked about male peritoneum yesterday. Now, in female peritoneum, you'll find that it is slightly more complex, right? Not very much. Basic concepts, they'll remain the same. So, when we really draw this thing, right? So, same our standard that we draw it like this. There would be the pelvic cavity, correct? And then the pelvic diaphragm, interischial line. This is urogenital region, correct? And this one would be the anal region. That's anterior. This is posterior. And it is this area which is called as the perineum. Remember, it is not in proportion, right? Today we'll see, right? As such, because there were few questions on pelvic cavity, so that's why we'll take it briefly. But as such, pelvic cavity will be discussed at length. But just for the clarification, yes, we'll talk about it. Then there was like perineal membrane, right? Then there was deep perineal pouch, superficial perineal pouch, and then this was the fatty region. True. Now, first thing first, we need to be very clear about so many nomenclature, right? So what we'll try to do is say this is same lithotomy position, right? Lithotomy position, person is supine. Now, instead of going randomly, we go step by step. As we always say, we'll follow a pattern, right? So this is Mons pubis. Mons pubis, this is the area, right? This is the area which is like a rounded eminence just in front of pubic symphysis, right? So there is pubic symphysis, and on top of it, this is a round prominence, round eminence. And why should it be? Because of subcutaneous fat, right? Because of subcutaneous fat. Yes, this fat has definitely to do with the hormonal changes. True. Moving on to the second part. Now, see, this is Mons pubis, that's the prominence. The second part, which we'll be discussing, and this is what is called as the anterior commissure, right? That area, this is anterior commissure. So, what anterior commissure is actually? Say, these are the skin folds. So, this is labia majora, right? Labia majora, major lips. So, this area, right? This one, both the sides they unite in front to form what's called as the anterior commissure. So I'll just write it over here. Anterior commissure is where this labia majora joins, obviously from both the sides. Fair enough. Now, when we talk about labia majora, anterior commissure, so there is something like posterior commissure, right? There is something like posterior commissure. So that is also where this labia majora they are joining, but on the posterior aspect. So over here, 1, 2, 3. Let's mark this thing as 4, right? Over here, also labia majora joins. Remember, these labia majora, they are nothing but they are thick skin folds, right? They are thick skin folds. Now, when we are talking about this major, there is one important thing which we need to know, and that is this portion. This is what is called as the gynecological perineum, right? That is where the things will come into picture when the episiotomy, etc. That is over here. This will be where the episiotomy would be done, right? So right now, this distance, gynecological perineum, right? That is just 2.5 centimeter. The distance between both of them, it is about say 2.5 centimeters. So that's gynecological perineum. So we just write 4A, right? So right now we are not, let's say, discussing more about it. We'll come back to that. Moving on to the next important structure, those labia majora, they were major thick skin folds, right? So then there is minora. So they are obviously the thin skin folds, right? These are thin folds. Now, if these are thin folds, now comes the most important part. Labia minora, two, it has got two layers. One is the upper layer, one is the lower layer or the inner layer, you can say. When these upper layer, right? See, remember we are talking about this part, this, right? I'll erase that. So this outer one, this layer I am talking about, right? So that layer, both the layers of labia minora from both the sides, the point at which they meet, sorry, the point at which they meet, that is what is called as the prepuce of clitoris, right? That is what is called as the prepuce of clitoris. So this is 5. We should put the number 6 over here. So that is where the upper layers, right? Upper layers of minora meets, right? By the way, so there'll be few terms like, say over here, the prepuce, glands, or say vestibule, right? Such names. Now these names will keep on coming. See, actually, the prepuce, that is foreskin, right? It is the foreskin, and this skin is covering what? This skin is covering the area called as glands. Now, in case of males, right, this is easy to understand. The glands is nothing but it is the round anterior part, right? It is the rounded anterior part of the penis, right? Rounded part. And the skin which is covering, that is the prepuce. Now, because this is the most sensitive part, those very sensitive parts. So same way, prepuce of clitoris, right? That is exactly like an erectile tissue, which is similar to penis in males. Now, these things are important to understand because that session which we are planning to discuss on Saturday, this Saturday we'll definitely be planning. That's why I was holding it up, because unless and until you don't understand this, it won't be making much of the sense, right? So now It is like that prepuce of clitoris where the labia minora is meeting. They from the both the sides. That is the erectile tissue. Right? Remember, this is the erectile tissue. And similar to penis in males. Right? But the most sensitive part is actually not that. That is the erectile tissue. The most sensitive, the way we said that in glands, in males it is the most sensitive, highly sensitive. Same way there is glands of clitoris, and that is what, that is where the lower layers of minora they are meeting, right? So it was like outer layers or the upper layers and the lower layers, right? So we are talking about this area and we are talking about this area, right? So that was the prepuce, and this one is the glands, right? Yeah, we'll talk about it. We'll talk about it. First, let's focus on the subject. So that is the glands of clitoris, right? And this is highly sensitive. This is highly sensitive, right? And yes, I just write, say lower layers of minora joints, right? So pretty easy. Okay, now take care. This is our seventh structure. Now the vestibule, there would be one word which will keep on coming, that is the vestibule. Vestibule, it means it's like a channel, right? Vestibule means it's like a space, it's like a channel. So vestibule of vagina, right? You can say it's a space or channel, right? The boundaries are formed by labia minora. Now in this space, the major difference between male and female, in male there is only one passage for, say, urine as well as the reproduction. However, in this case, in case of females, they both are different, right? So here, the vestibule of vagina, that is the area, and then there is a fossa, right? Then there is a fossa on the posterior aspect. There is a fossa, there is a shallow depression, right? So that is shallow depression. Now things are easy, right? This one would be the urethral orifice, right, which is anteriorly, and there is the vaginal orifice, which is just behind it, and the final, this anus, that is absolutely posteriorly. Fine. These are greater vestibular glands. Now these greater vestibular glands, they open at this point. That's the location, right? Which is on the both the sides of the vaginal orifice, right? Plays a vital role for the lubrication, right? So that is the final structure. Now see, the way we talked about that these are the greater vestibular glands, correct? These are the greater vestibular glands. They'll be having ducts also. The same way, you'll find that there are bulbourethral glands, right? Bulbourethral glands. And these are in case of males, right? They are called as gland of Cooper. Okay, so these were the major points which were needed. Well, this is like cutaneous innervation, right? Yesterday I said that you just keep on drawing that cutaneous innervation so that you are comfortable with the major nerves. If you have really done that, this is very easy. There was dorsal nerve of penis over here. This is dorsal nerve of clitoris, right? So which gives supply to skin of clitoris. Correct. Then these nerves, ilioinguinal nerve and genital branch of genitofemoral nerve. How many times we have talked about it, right? So they are over here, very important. And what they will be doing, see the anterior 1/3 of labia majora, anterior 1/3, right? So that is anterior 1/3 of labia majora. That is also easy, right? And then once again, these perineal branch of posterior cutaneous nerve of thigh. Yes, we were talking about that also. So it will be taking care of rest, right? This is skin of lateral part, right? That is the urogenital. So this is skin of lateral part of urogenital region. Plus anterior part was by ilioinguinal nerve plus the posterior, rest of the thing, right? Posterior 2/3 of labia majora. At what time you want the sessions in the morning hour? What time? We can plan that, not a problem. But what time? Just let me know, right? Okay. So that is skin of lateral part. That is taken care of perineal branch of posterior cutaneous nerve of thigh. Finally, the fourth one, posterior labial nerves. And in case of male, it was posterior scrotal nerves. And so that is, if this was taking care of perineal branches, they were taking care of lateral part, right? Here is the lateral part. So these scrotal nerves or the labial nerves, in case of female, they will be taking care of medial part of urogenital region. Done. Rest of the structures we already know: urethra, labia majora, minora, vaginal orifice, clitoris, right? That we have already talked about. Okay. You do remember this? As I was telling, that S2, S3, S4, right? Do remember this. All sacral nerves, right? And these are the root values. These are the root values of that cutaneous innervation. Correct? But see, they also supply parasympathetic fibers to pelvic organs, right? So these are like pelvic organs, and their parasympathetic supply, that is also coming via these routes. Parasympathetic supply. So what really happens is that in case okay, do one thing. Do one thing. Send a mail to me, right? Whether you want it or you don't want it, right? Don't worry about it. We'll see. We'll see. Because see, now there are about 4 or 5 sessions in this abdomen left out, but all the sessions, they are quite important, right? They are pretty important because all the sessions, they are based on each other. Now today also we'll be discussing some of the structures, and suddenly you will feel from where this structure is coming. But the moment you will learn urethra, the moment you will learn the uterus, everything will be like, now it is fine, right? That is what would really happen, no doubt. I'll try to integrate as much as possible. So just send a mail, otherwise we'll keep on talking about this timing only. And today, though again there are less figures, but so many good things to discuss about. So over here, that any disease which if it occurs over here, any disease here, it will lead to the referred pain, right? Because of this common supply, it will lead to referred pain in perineum, right? So even if there is some disease in the pelvic organ, there will be lower abdominal pain, there will be lower perineal pain. That is because of them, as it is a common supply. Okay. This you already know regarding the fascia. Now there is very less of the difference, almost the same, right? If we said that there is superficial fascia, right, and there is deep fascia, correct? That superficial fascia once again divided into superficial, so we can say superficial fascia, right, and the superficial deep fascia. But to make it easy, it is called as the fatty fascia, and this is, you are right, it is membranous, right? Membranous, also called as the Colles fascia. And the superficial fascia, so it continues with the surrounding, right? Because it is superficial. So we just say it continues with surrounding. So that's easy. Surrounding. It is the deep membranous fascia. So it is this deep membranous fascia which will be all the way getting connected to even the perineal membrane, right? So in fact, those pouches will that pouch would be made at that point, because perineal membrane is what? Perineal membrane is that thickened layer of the deep fascia, correct? So right from the pubic arch all the way, it will go till perineal membrane. Regarding this deeper one, this is what lines deep perineal space. Got the idea, right? And or we can just, I don't mind, right? We can really draw it. Uh, we'll come to this picture, right? First, let's draw. So make things completely clear, right? So that is pelvic cavity. This one would be pelvic diaphragm. Pelvic diaphragm. Okay. We'll talk about pelvic diaphragm also, because there was one query about it, right? This in between, that is interstitial line, and this is perineal membrane, right? This is perineal membrane, the membrane which has got that free posterior border, right? That's what you have to remember, the free posterior border. Now what this will do, this is like there is a deep fascia, right? There is a thin fascia over there. So this is like superior layer, or the superior layer of, say, this urogenital fascia. Fine. This is superior. And this perineal membrane is inferior layer. But this inferior layer, because it is thickened, right? Because it is thickened, so it has got a new name, and that is perineal membrane. In between space is now called as the deep pouch, or the deep perineal pouch. Okay? Now this entire piece, right? No confusion. This entire piece, that is urogenital diaphragm. Urogenital diaphragm, right? And then there is a space. So it's like a thick layer, right? Not that thick, but just relatively thick, and a thin layer, right? And this entire thing, which will be having some contents into the deep perineal pouch, and that whole thing is called as the urogenital diaphragm, right? Below, what would happen? Over here, that's the membranous layer, right? Membranous part, or the membranous layer of superficial fascia, correct? So that is membranous part of superficial fascia. Superficial, what have I written? Let me write properly. Superficial fascia. right? And this would be the superficial perineal pouch. Hmm? And what about this part? We should draw it with yellow because this is the fatty fascia. So that's where the fat is. So this is how things are arranged. Now let's go back and then we'll talk slightly about this pelvic diaphragm because there was one very interesting query. That's why. Right. So this is the perineal membrane. Thick perineal membrane. So far, so good. So here is one figure which draws our attention. This is where we need to see four important things. Four, right? First thing first, perineal membrane crystal clear. That's the layer. That's the perineal membrane. So above the perineal membrane, what it is? Above the perineal membrane, we have got the deep perineal pouch. So then where is pelvic cavity? Right? The pelvic cavity is is where we drew that this pelvic diaphragm, right? This pelvic diaphragm. So this pelvic diaphragm, so from where the pelvic diaphragm is coming, this pelvic diaphragm, also the pelvic floor, it is also called as the pelvic floor, right? That is formed by two muscles, levator ani and coccygeus, right? There are parts of it, we'll see that, right, at a later stage, right? But this pelvic diaphragm, levator ani and coccygeus from both the sides, they combine to form this pelvic diaphragm. So what this pelvic diaphragm is doing, this pelvic diaphragm, this pelvic diaphragm is differentiating between pelvic cavity and the perineum. Now technically perineum is a small space, right? It is that space which is between the thighs just at the end of the trunk. It is the last part, right? Pelvic cavity is super important because all the pelvic structures they are over there. But then what about the abdomen? Well, that's the point, right? That's the point. When we say that pelvic diaphragm is between pelvic cavity and this portion is perineum, right? That portion is perineum. So above above the pelvic cavity there would be abdominal cavity, right? But actually in between both of them there is no physical structure. They are very smartly divided, very smartly. They are divided by one very interesting plane, by a layer, right? A plane. So this pelvic cavity, what we are watching, this part, it will be having pelvic inlet, right? Pelvic inlet, then the pelvic cavity itself and the pelvic outlet, right? Pelvic inlet, pelvic cavity and the pelvic outlet. And that is the point where you need to understand that how it exactly forms. So for that, we'll pick up a very simple concept. We have talked about peritoneum, right? But that peritoneum is over here, right? That peritoneum is over here. Everything over here, they are covered by all those peritoneums. But then at one layer the peritoneums they'll get completed and then those organs they will start traveling down and over there into the pelvic cavity they are not covered by peritoneum, right? They are not covered by peritoneum. Volume is just a minute, just let me check. It should be okay because over here meters so they are showing completely fine. Is it problem with everyone? So in that case, then I have to boost because it will happen like if I raise beyond certain level, now the quality of the voice will be deteriorated. Right? There'll be few disturbances. As such, there should not be any problem. But if everyone is facing, just let me know. Okay. I'll just check it after a minute. Huh. So I was talking about that it is the peritoneal folds which will be over there. So we'll see that how exactly it happens in case of peritoneum and all those visceral fascias. So that's the perineal membrane. So here it is. See on the top, say this is deep transverse perineum, that is the muscle, right? That's the pelvic fascia. And say, you know about perineal body, right? There was perineal body. Perineal body was that where where 10 muscles they were meeting, right? 10 muscles they were meeting. Out of those 10 muscles, one of them was bulbospongiosus, right? Bulbospongiosus. We remembered it like blessed, blessed, right? So one was bulbospongiosus, and here is that bulbospongiosus. Here it is, right? This is bulbospongiosus. Okay, so that is one. It is bilateral, so it is on both the sides. Then levator ani, correct? Then external anal sphincter. All these structures will be crystal clear today, right? And then there was superficial transverse perineal muscle and the deep transverse perineal, and then there was like a sphincter, right? Was in the form of longitudinal muscles. So at least this bulbospongiosus, this is where we are watching it, right? So perineal membrane, these are the greater vestibular glands. Got that, right? These greater vestibular glands, if you see, they are opening into the vagina, right? By the way, just it reminds me, this is a small fold, right? Small fold, and this is what is called as the hymen. Now there is something what is called as the virginity test. Now, as such, medically speaking, right? It's said that if the hymen is damaged, that means that female is not virgin. Actually, it is not so. See, this depends upon, say, many of the sports activity, right? Say for example, cycling or any of the activity in which there is stretch, say it may break, right? It's okay, right? So it is not so that okay, this is the supreme test for virginity. Not at all. Okay, I'm not discussing right now the parts of uterus, right? So that uterine cervix, etc. Right? Because uterus it's a separate topic. We'll talk about it. Labia majora, minora, these are the posterolabial vessels, ischio-cavernous. Hang, just hold on a minute, right? They are coming in much better figure. Okay, so this is what we talked about. Let's draw one more figure, and this will add something extra. If we say this is urethra, right? So on both the sides, we have got ischiopubic ramus, right? Ischium, ilium, and pubis. So this would be like ischiopubic ramus. So this is like a section, right? This is like a section. So that's the bone, right? That's the bone. From there, from there, the muscles. Which muscle would it be? This would be, right, externally it would be obturator internus. Yesterday we talked about it, right? Obturator internus. This is urethra, right? This is urethra. And we said that it is the perineal membrane which is pierced by urethra in case of male. And it would be pierced by urethra and the vagina in case of female. True? So let's draw this. So this is what this is, perineal membrane, right? Or the thickened inferior fascia of urogenital diaphragm. Fine, right? I'm now writing it in bit short, perineal membrane. And when I say thickened, you automatically understand that we are dealing with the thickened inferior layer, because the upper one, that is the superior layer, right? This superior layer is not that thickened. And in between, it is the deep pouch, right? And the whole thing is called as the urogenital diaphragm. And then there will be few contents of urogenital diaphragm. Fine. And over here, this one would be the superficial pouch or the superficial space. Superficial space. Now, this particular space, right, this is quite compact, right? It is a smaller one, right? And there is accumulation of fat, etc. So any infection over here, that is pretty painful. So that's how things are arranged. Yeah, that's right. This one would be the membranous layer, right? It would be the membranous layer of superficial fascia. Superficial fascia. I got one very nice mail, right? That gentleman, he wrote that, "So there are so many structures. Please show some way how to remember all of them." Well, this is true, right? And in medical, so as you will proceed, there'll be even more and more structures, more and more names would come. The best thing is, I'm giving you just three secrets. Trust me, they are super effective. One, draw. Seriously. Whenever you feel like you're just, it's not necessary that you should be very artistic. Scientifically correct. Just keep on drawing. Okay, this is this muscle, draw and label. Right? Draw. This is very powerful. Second, what is called as the spaced repetition. Spaced repetitions. Spaced repeats. This is where we really miss. In one of the session, in one of the film, I mentioned about it, that say even if you are super brain, you are fantastic with amazing God-given memory, but still if you don't go for spaced repetition in the initial part, right, you'll start forgetting. And the worst part is, say today is like day zero. If you don't revise within 24 hours, you start losing almost 50%. So this first day revision, that is so important. That's the reason what we really do. At times we try to repeat some of the points, right? So that automatic आपका first revision हो गया. Then within 3 days you have to go through it again. Then 1 week. The sweet spot starts from this point. After that you have to revise after 3 weeks, then 3 months, and then in 1 year. And the best mails, right? I got few of the mails and they said that now we are actually revising the entire region, that is entire lower limb from morning, and by noon, so we are completing it. I was so happy to read that mail that yes, it goes that fast. Actually, it would go. And then seriously, like Vivekanand, right? You are just scrolling. I mean, he was turning the pages, and you will be scrolling, and someone will feel that what is this masti, right? But yes, you are revising it at that lightning speed, and you will be able to remember it everything. This is true for everything. And third, and this is most important, right? Don't worry much, right? Say you are human being. You are not robots. So it's fine if you miss 1 or 2 points. It's okay. It's completely fine. Don't put that much stress on yourself that okay, there are 10 muscles. Arey, which was the ninth muscle? Arey, it's okay. It's okay. Right? And trust me when you'll write it now. And in case if you have made that mistake, and when you'll see and then you'll see, Arey, I missed this much. Right? Next time you'll be able to remember it very crisply. So this is where, technically speaking, don't let the cortisol develop. Because if the cortisol is there, stress is there, that stress would decrease your performance. And that is something which we don't want, right? So maje se try to read. And but if you follow this principle, you'll definitely be very successful. Okay. So we were talking about, right, this abdomen. Then there is pelvic cavity. And then there is perineum. This part to make sense, right? That in between pelvic cavity and perineum, there is pelvic diaphragm. And this pelvic diaphragm, say thanks to levator ani and coccygeus. So they both are handling it. This is also called as the pelvic floor, right? So that makes a complete sense because this is the pelvic cavity. So this is a floor. Fair enough. So it means if something is entering over here, so we'll call it pelvic inlet. And as the pelvic cavity is about to get over, so we'll call it pelvic outlet, right? In between is the pelvic cavity, and this is true pelvic cavity. So if we are telling true, so there must be a false pelvis also. Yes, definitely there is false pelvis. Regarding your question, Megha, it's like if you follow these notes, right, the major concepts they will be taken care of. But yes, in books, say it would be impossible for me to cover every bit, every line, every point. So that because of the time constraint, right? Some of the things are to be skipped. But definitely, major things all are taken care of. But still, once you understand this thing properly, go through the books and mark those points which have not been discussed over here or something which you find important. So write it in the book only because it's your book. You can always write, right? So that's how you'll be going for division. Again, I am not against Grey's Anatomy, right? And I replied to few of the emails that yes, it is a fantastic book, a superb work, but it is a reference book. I myself never tried that. I tried it and I was not very successful. After that, I am telling you that once the concepts are clean, then you go for reference book. It gives you super pleasure. But before that, yes, it gives trouble because one topic it is spread across so many pages with those small fonts and some bit of complex language, right? So at times we keep on getting confused. Okay, boss, what exactly are you trying to tell me? Can you put it in simple words? But well, it will not be there, right? So, and I feel that the keywords are important. We always remember the keywords, and one keyword it gives the whole context, right? The way we used to do cheating in the examination means not you, me, right? So in case if we forget anything, so how do we do that? Right, we just see that, yes, right, we just see one word and then we remember everything, right? It was not like whole supplementary and we are just copy pasting, right? But I think you are also like me only. You must be also doing, and this is not cheating. This is just slip of mind, right? Just one word is slipped. Don't tell it this thing to any of your teachers. Huh? So this abdomen and pelvic cavity, in between this inlet, this is a plane of division. right? This is the plane of division. And how it happens? That now visualize the pelvic cavity on the posterior side, there is sacrum, right? On the anterior side, so there is posterior side, there is sacrum. On the anterior side, there is pubic crest, right? And on both the sides, there is ilium, right? Now those ilium, they are big, right? Ala of ilium, they are big. So that sacrum, which is on the posterior side, and this pubic crest, which is on the anterior side, a plane which is passing through this level, pubic crest to sacral promontory, right? That prominent ridge, that sacral promontory. So that level is telling that, okay, from this point onwards, right, it is the pelvic inlet. The importance, inlet, outlet, the that baby would be traveling through this space. It has got immense obstetrics importance. So then what about the false pelvis? Right? So in pelvis, it is divided into, like, say, false pelvis and the true pelvis. False pelvis is also called as the greater pelvis. So those ella, right, of ilium, right, those ilium, so they are actually forming that pelvic cavity in which actually the abdomen contents are there. So there is abdominal continuity into that. But the true pelvis is that pelvis which is smaller and which would really start from the inlet onwards, right? So now you can know that those elas, they are on the both the sides. That sacrum is lying over here. From sacral promontory, you are drawing a line of to that pubic crest. But so that is inlet. Below that, it is true pelvis, and just above that is the false pelvis. We'll see the image also. Right? I think you have understood this part, right? Say, say this is like, say that is sacral promontory, right? And then that is the ilium, right? So this one would be, change the color. This one would be, say, sacral promontory. Promontory. Over here, that would be pubic crest, right? Pubic crest. And these curved lines, they will be called as the arcuate line, right? Arcuate line. And in between, right? In between, that is what? That is iliopubic eminence, right? Over here. So iliopubic eminence. Now, this is just I'm trying to explain it in a way that there would be few diameters: the anteroposterior diameter, the transverse diameter, the oblique diameter, right? So anteroposterior, transverse, and the oblique diameter. Now these diameters, they will be playing a vital role. They'll be playing a vital role in the complete obstetrics, right? And even in pelvic cavity also, right? We'll be having that topic. I think tomorrow only we'll be discussing the complete pelvic cavity in complete detail. But all those measurements, they are very, very interesting. Say, for the pelvic inlet, the mid pelvis, right? Mid pelvis, that is the pelvic cavity itself, and the pelvic outlet. All those measurements, they are like, what is the AP diameter and what is the oblique diameter and what is the transverse diameter of mid and outlet and etc. So easy, right? Write it like this: AP, anteroposterior, oblique, right? And the transverse, right? Transverse diameter. It's like a game. Everything is in centimeters, right? So, in case if it is needed, So just like say 1 inch is equal to 2.5 centimeters. But say even in book it is given in inches, converted to centimeter. Easy to remember. And it will give you one very interesting concept. And that is, just remember 11, 12, 13. Right? 11, 12, 13. 11, 12, 13. And this one, 12, 12. Done. These are all the obstetrical measurements of true pelvis, right? This is about true pelvis. That means it was having inlet, mid pelvis, outlet of pelvis, all done. Now see these figures. Imagine a bit. For the inlet, the AP diameter is small and the transverse diameter is more, right? See, oblique diameter is remaining same in case of all three, inlet, mid, and outlet. So if I want to draw a figure, right? Should I draw it something like this? Change the color, right? Should I draw something like this? Right? Not in proportion, but just for the understanding, right? I would we would draw it like this. So AP diameter is less and this transverse diameter is more, right? But when it comes to outlet, what is happening? The shape, there is a change in the shape. There is a change in the shape. And that change in the shape is like the transverse diameter, right? The AP diameter of outlet is 13. So this is more, right? And this transverse diameter is less, right? So that's the change. That's the change. And this is the change which will be having a significant value for the entire process of delivery, right? So just do remember, as such, in any case, we'll be talking more about it with all the landmarks and from where to measure it, etc. When we'll be talking about, say, pelvis. But still, do remember this part. Okay, here it is. If you understand this, you understand everything. Everything. And I'll modify it slightly. So where is abdomen? Well, this is all covered with peritoneum. है ना? So technically speaking, that's abdomen. But this, say this is what? This posterior portion, right? That is that coccyx, right? Just for the reference, this is anterior, true, and this one is posterior, right? Say this one is rectum, that one is rectum, so this is posterior. Okay, this is urinary bladder. Just orient yourself properly. That's urinary bladder. This one would be, in that case, this and this. They are that ramus, superior and the inferior ramus, right? Because over here it would be the pubic symphysis, right? This would be, from here it would be the pubic symphysis. So this is superior and this one would be the inferior ramus. So in order to see this thing, we need to remove the peritoneum, right? Removed, right? So everything is covered in fascia, right? So this portion, right, this above portion where the uterus is there, right, where other structures are there, but still they all are into the abdomen. Now in between uterus, that's the uterus, right? This one is the uterus. And yes, we'll be talking about that. That's a round ligament, fallopian tubes, right? All those ligaments, we'll talk about it. But in between, there is a space over here. That's the space. This is the space between uterus and the bladder. So that's why it would be completely fine if we call this space as uterus is also always called as the vesicle. So it is called as the vesico uterine pouch or the space. So in that case, there is space somewhere over here also on the posterior side. This is the space which is actually between uterus and the rectum, right? So it would be recto-uterine pouch, right? So here it is recto-uterine pouch. But what we are interested in, that where is that pelvic floor, pelvic diaphragm? Here it is. Here it is. It is this. This. That is the pelvic diaphragm. And who will be contributing it? That muscle is levator ani. Here it is. Here it is. That's the levator ani. See? Right? So this one would be levator ani. This one is anus, right? And these are the major labia majora and the minora, right? This one is minora, this one is labia majora. Okay, so this uterus, right? Here is the uterus, and this one would be vagina, right? Okay, other structures, they are pretty easy. Over here is the sigmoid colon. That's the sigmoid colon. And all these are, this is what? Right? These are tinea coli. Right? These are tinea coli. No. Uterus is uterus. Vesico is urinary bladder. Right? So vesico is vessel. It is urinary bladder. Right? Uterus is uterus. So vesico uterine pouch. Similarly over here, recto-uterine pouch between rectum and the uterus. Fine. So this is, now see this layer. I'm highlighting a layer. Say this one, right? That layer. This layer is called as the visceral pelvic fascia, right? All these are, say, visceral pelvic fascia. So now we know that when we talk about perineum is a very small, very lower structure. True? So this is just for the orientation, right? And we'll keep on adding more and more structures to it as we proceed. Yeah. Over here, there is so much to understand. First, let's orient ourselves. This is anterior, right? Because that's the pubic symphysis. So that's anterior. Over here is the sacrum, so that one is posterior, no doubt about it. So what exactly our view is? This is like a caudal view. We are watching from below, right? Say from here, there would be femur. So this is a caudal view, watching from below. First important thing which strikes, and this is this area, and that is perineal body. So we'll just write P, perineal body. Perineal body is that junction point where so many muscles would be landing, correct? So first one, bulbospongiosus, right? We remember bulbospongiosus. Now it would be crystal clear. Here it is this bulbospongiosus, this one, right? Bulbospongiosus. Bilateral, so it is on both the sides. Okay. So in that case, what is this? Well, anteriorly, so it has to be ureteric opening, and this is the vagina, and this one would be the anal canal, right? Perineal membrane on both the sides, right? This is superficial transversus perineae. So these are superficial transversus perineae. This would be deep transverse perineae. See nicely, everyone meeting over there, right? So superficial, deep, and the bulbospongiosus. So this is 1, this is 2, this is 3, right? So they are done. There was one more muscle, levator ani, right? That's the levator ani, right? All this. And then there are several parts of it, right? So that's levator ani. So done. Chalo, this part is done. Then there was external anal sphincter. So here is, this one is the anus. So all those sphincters surrounding it, all these muscles which are again landing on the perineal body. So that is external anal sphincter. Yes, there are parts of it, right? There are parts of external anal sphincter. Superficial, right? Then superior, inferior. And for the support, this is a ligament. This is from anus to coccyx. This is coccyx. So we'll call this as anococcygeal ligament, which would be for the support, right? Which would be for the support. These muscles, these are super important. This is ischiococcygeus. See, not difficult. This is what, that is the ischial tuberosity on which we sit, and this one is coccyx. So this has to be like ischiococcygeus. But all these muscles, including this is piriformis, right? Piriformis. Now see, all these muscles, these are the muscles of pelvic floor. When we say that why some of the exercises, they are vital, because those exercises, they will be keeping these pelvic floor muscles strong. The importance of these muscles is phenomenal. This ischiococcygeus, bulbospongiosus, they are phenomenal importance. For the males, right? For the males, it is like that erection. It is not only just one process. It is, erection is like that when the size of the penis increases because of the pooling of the blood, but at the same time it is necessary that those veins, they should be occluded, right? Then and then he can sustain, and that is where these muscles will come into picture, right? So we'll talk after a few minutes about it, but the idea is, and this is true for male as well as females, right? For females, this will be carrying tremendous importance during their say obstetric part. So pelvic floor muscles, when they are strong, it will make your life more beautiful, right? So these are the important muscles. Just for our understanding that this levator ani, right, it would be divided into several components, right? Several parts. That is puborectus, pubococcygeus, etc. Because it is a huge, big one, right? It will go all the way like this. If you remove this deep transverse, it would be actually forming that entire floor, right? And you remember we said that that entire floor is formed by that by levator ani. This is where, right? So it will actually form the entire floor. If you remove this deep transverse perineal, superficial transverse perineal, so it would be forming that entire floor. And you'll see this thing tomorrow when we'll be talking about, say, only the pelvis. But just keep in mind that it has got several components. And we'll discuss it on Saturday, right? I was talking about the exercises which is called as the Kegel exercise, right? These are the Kegel exercise. It's like an investment. When you are young, you should do this exercise. But because body is in its finest of the state, right? All the muscle power and everything is so phenomenal. But the way you invest in your young age and you'll get the fruits when you'll be old, same thing is for this. This Kegel exercise will keep your pelvic muscles super strong, and that is what it is needed. Otherwise, it happens like that at a later stage of the life when person has got enough money but they don't have anything else. Right? You got my point. Okay. All right. Yeah. Very, very vital point. Very vital concept. Say in case of male, in urethra, there is distal urethral sphincter and the proximal urethral sphincter, right? In case of male, that sphincter, urethral sphincter. So when there is strong urge to go to washroom, so these urethral sphincters, they will constrict, right, till the conditions are good. So urethral sphincter in case of male, there is a proximal and the distal urethral sphincter. In case of female, there is no proximal urethral sphincter, there is only a distal urethral sphincter. So here, that's the distal urethral sphincter. But see, these fibers, their arrangement and their parts, they are very typical. So first thing first, this is what is called as the rhabdosphincter. Rhabdosphincter. This is voluntary, right? This is under voluntary control. And this is almost along the entire length. This is like a main sphincter. Main sphincter. Because in females, there is no proximal sphincter. So this sphincter will be playing the major role. Apart from it, so this is one. Apart from it, the compressor, name itself, compressor urethrae muscle, the muscle which will be compressing the urethra, right? This is deep. This is deep. And there is one other set of muscle which is superficial. It is uretrovaginal sphincter, right? So this is superficial. Superficial. I'm so sorry, someone is. Right? So these are the 3 points which you need to remember. One point I would write, uretrovaginal sphincter, it lands on over here, and that is perineal body. Right? It lands on perineal body posteriorly. Right? So that is superficial. This is compressor urethrae. See, the importance of this compressor urethrae and uretrovaginal sphincter is like they prevent that continence. Continence means that is when some of the urine that remains into the bladder. So what they really do, they contract just to spill off even the last drop of urine, right? So that is the importance of it. Okay, so these are the three parts. Okay, in this, yeah, here it is, right? That is the perineal body, right? This one is the perineal body, and that's fine, right? Superficial transversus perineae, that is meeting over there, right? And here it is the bulbospongiosus, that is also good. On the surrounding, this is ischio-cavernous, that's the perineal membrane. Perineal membrane is what? That thickened layer, right? And this is anterior. So here it is the urethral orifice, right? That is cross of clitoris, the sensitive portion, and the vaginal orifice, that is over here, right? That is over here. Just a sort of revision. Okay. What are the structures which will be piercing, right? Structures piercing it. So right from this urethra and the vagina, right? These are the two important. So here it is, the structures piercing perineal membrane. Apart from this, most of the vessels, they will be having very similar corresponding names. Say deep dorsal vein of clitoris, right? Dorsal nerve of clitoris, dorsal and deep arteries of clitoris, right? Over there, it was penis. Over here, it is the clitoris. Artery to bulb of vestibule. And see this posterior labial, over there it was scrotal. Correct? So all names are similar. That is what pierce the body. And then few muscular branches. That's okay. All right. See, now we have talked about most of the things. There is just one, and this is superficial perineal pouch. Even without explanation, you will be able to understand that what is at the deepest layer, because see, when we draw it, right, when you draw it, so at the deepest layer, it is what? It is that membranous, right, or the Colles fascia, that is where it is arranged. Then the perineal membrane, ischiopubic rami, etc. Right? The importance of this is, say there are muscles on each side, right? And these muscles are, say, ischio-cavernous, bulbospongiosus, and the superficial transverse perineum. These muscles, they are like superficial muscles, right? These are like the superficial muscles. And these muscles, they have got tremendous importance. We talked about it. Sorry. Right? So these are the superficial muscles. Deep muscles, they will be all sphincters. Now, say this ischio-cavernous. Right? This ischio-cavernous, this is the muscle, because it is important muscle for males, right? Because this is the muscle which covers that crus penis. So it is this muscle which maintains erection. The important muscle is actually bulbospongiosus, right? Now, the bulbospongiosus, as we were telling, bulbospongiosus, it has got two functions. One, the erection. But the second function is that its anterior fibers, right? Though there are anterior fibers and the middle fibers. So these anterior fibers, they will be actually compressing the deep dorsal veins, right? So they will compress deep dorsal veins. Now, when the veins are compressed, so it would prevent emptying of these veins. When the veins are being prevented, that will give that sustainability. And this is the reason that joint effort would be that it would be playing an important role into the ejaculation. Right? And all these muscles, that's where those exercises they play a major role. Right? So ischio-cavernous, bulbospongiosus, and the third one, which we said that they are the superficial, that is the superficial transverse perineal, right? Superficial transverse perineal. The function of superficial transverse perineal is like because it is landing on perineal body, so its function is more or less like a support function. The easiest and the important thing to know and to remember about all of them that they are supplied by perineal branch, right? Perineal branch of pudendal nerve. All three of them, they are supplied by perineal branch of pudendal nerve. Okay. There is the pudendal canal. Say this one. See, this is the pudendal canal. That's the location of pudendal canal. You know the meaning of pudendal? Something one should be shy of. That is actually the name of pudendal canal, pudendal word, right? Pudendal's actual meaning is say something to be shy. I don't know who has given this name, but anyway. So that pudendal canal, this is in the now you know ischioanal fossa, right? Ischium and anal. So that's on both the sides. There is ischioanal fossa. So in the lateral wall, right? So I'll just write like say lateral wall of ischioanal fossa. That's where this pudendal nerve is. Oh, I mean the pudendal canal is there. So see, this is ischial spine, lesser notch, and that's where the perineal membrane, and that's the location of pudendal canal. Right. Posteriorly situated, right? And on both the sides, later on, right and left. And what it is carrying? Well, these are the contents, right? These are the contents of pudendal canal. As I said, just remember, pudendal nerve, that is one, and second, internal pudendal artery and vein, this one. Just remember these two. The reason behind it is, just a minute. Oh, it is about to, just hang on, it will take a second. Just a minute. So pudendal nerve, and see rest of the contents, right? That is the dorsal nerve of penis and the perineal nerve. They all are branches of the main pudendal nerve. Same way, if we see over here, internal pudendal artery and vein, and then we have got the dorsal artery of veins and veins of penis, and the inferior rectal nerve and vessels, right? Again, they are part of this internal pudendal artery and vein. So these are like most important, the star ones, right? One and two. Do remember it. Okay. This is but then we need to find out from which desh he is. Right? So Sharmila. He must not be that much Sharmila. Because at least having that much guts to say कि अच्छा अच्छा this is the name. Okay. So here it is. So again the pudendal word came. So this is internal pudendal artery and vein. Well, pretty important. Just for the reference that how exactly it is associated. You know about, say, internal iliac artery, correct? That is from aorta to common iliac to internal iliac and external iliac, and this internal iliac once again will be divided into anterior and the posterior, right? And from anterior, the internal pudendal artery, right? This is the chief artery of or chief artery for right should not for external genitals. So this is the chief artery. So that's how it gets distributed. In male reproductive system, because that topic will come again, that is where we'll be talking about all these vessels. But this is just for our understanding that this is internal pudendal artery, which will be giving, say, this in inferior rectal vessels, right? Then there'll be perineal artery and vein. There'll be transverse perineal artery and vein. All those are branches of this internal pudendal because it is the main chief artery. And finally, this is what is called as the pudendal block. It is called as the pudendal nerve block. In any of the vaginal operations, right? Because this is sensory, right? This is sensory. So that's the location of the pudendal block. So that is site for that block, right? So that's it for today. So thank you so much, right? And do revise this thing because tomorrow we'll go for that pelvic cavity because it is like that there would be lots of mathematics sort of thing, all those calculations here there. I'll also show you some of the ultrasound images so you'll like it, right? And technically very important. So thank you so much once again. I'll save this file and I'll put it into our shared folder and see you tomorrow. Bye bye. And yeah, just let me know for that you want it in the morning hour or evening hour, right? Anything is fine. Just I'll need a day to adjust my schedules. So just let me know. Why so jaldi? Arey, it's not jaldi, 1.5 hour. Your capacity has increased. All right. Thank you so much.